Since its humble beginnings in 1902, 3M has become a household name and a healthcare name, with innovative solutions from drug delivery and oral health to infection prevention and food safety. How did healthcare software become another chapter in the 3M story of science applied to life? In the 1970s, 3M disrupted the use of paper medical records by enabling their storage and retrieval on microfilm. In those days, coders manually read charts to hand-match diagnoses against dense lists of numerical codes. This process was time-intensive and prone to human error. As a hospital IT director, John Morgan felt there had to be a better way. By mapping the decision processes that coders followed, Morgan developed software that matched codes faster and with fewer errors. He built a mainframe into his family RV and toured the country's hospitals, pitting his code finder software against the best medical coders around. HIM directors saw the potential, and so did 3M. In 1984, 3M acquired Morgan's company, bringing 3M to Salt Lake City, and introducing his code finder software to 3M Health Information Systems. Just as microfilm had displaced paper, computerized health records continued the digital disruption. As coding improved, the industry still lacked a good system to determine what treating a given patient should cost. Since providers were reimbursed on a cost basis, they carried little financial risk, and there were huge variations in cost. The Centers for Medicare and Medicaid Services was searching for a way to standardize these payments. Rich Averill and his team had a new idea. They grouped patients by diagnosis, then measured the resource consumption across different hospitals and geographies. This created a cost benchmark that accounted for a given patient, procedure, and facility. Grouping patients not only helped determine what a given diagnosis should cost, it helped hospitals see where they could invest and best deliver care. This idea was so powerful that the Reagan administration made it the basis of Medicare payments in the United States, creating the world's first prospective payment system. Again, 3M took note. The company combined its now proven coding expertise with grouping methodologies and benchmarks, creating the 3M Coding and Reimbursement System. In the 1990s, 3M developed additional software and services to improve the clinical documentation that fed into the entire process. Then, with the transition to ICD-10, the industry faced new productivity challenges. So 3M combined its coding, grouping, reimbursement and documentation tools with natural language processing and software automation to create the 360 Encompass system. This single application can capture, analyze, and identify medical codes and quality indicators across the continuum of care. The results of these efforts speak for themselves. 3M is the most widely used medical coding software in the world. We have hundreds of industry and technology partners. DRG grouping concepts provide a foundation for payment across the globe. Our clinical discovery engine processes more than 60 million unique healthcare records every month. 3M partners with government agencies to develop and continually update our unique methodologies and benchmarks. In fact, the healthcare industry processes more than 2% of the U.S. GDP every year through 3M HIS systems. By applying science to health data, 3M Health Information Systems has developed more than a dozen core capabilities, from data management and nosology to reimbursement and risk adjustment. Today, those capabilities drive us to focus on two key areas: revenue cycle management to ensure accurate and compliant reimbursement, and performance management to improve health system and health plan performance while lowering costs. We continue to use healthcare technology to look ahead, and just like John Morgan and Rich Averill, we come back to the same question: how can we help deliver better care at a lower cost? For more than 30 years, 3M Health Information Systems has helped patients, practitioners, health plans, and governments do exactly this. So how can we help you?